Good morning, good afternoon, good evening, wherever you are in the world. I am so excited about being here with all of you today. My name is Anton Gunn, and I am an advisor to the Intersection, a Robert Wood Johnson initiative with the focus on leaders in advocacy and healthcare. As always, it's so refreshing to be amongst this group of people who are working towards a future where health is no longer a privilege, but it's a right, and a future where health systems are trustworthy, accountable to their communities, and deliver high quality care to everyone. But I'm gonna be real honest about something. I'm gonna just keep it real because that's what we do at the intersection. 2025 was a tumultuous year for us. We saw large scale rollbacks on diversity, equity, and inclusion. A lot of programs were cut that left organizations navigating this changing landscape, the changing priorities, policies, and budgets. And next year is not going to be any different. There's more change to come, including federal Medicaid work requirements and likely changes, imminent changes to the Affordable Care Act premium tax credits. This is all going to make health insurance more expensive for millions. But today, we're here to celebrate. And the reason why we're here to celebrate is for one main reason, is because we're more committed than ever to this fight. And we're still here in the fight. We're showing up for our communities and finding creative ways to continue driving equity efforts forward. So here at the intersection, we acknowledge that this work is not easy. It has never been easy. It takes persistence, motivation, and the efforts of many people working together to change systems, to change minds, and improve the priorities that are focused on improving health outcomes for all. It's hard work, but it is necessary work. And it's something that we can't stop and won't stop doing. So today, we're here to provide you some motivation, some inspiration, some education, and some direction as we head into a new year. And there's no one better to help get us started, to energize us and inspire us than my colleague, another advisor to the intersection, and the president and CEO of the National Council of Negro Women, and that is the Reverend Siobhan Arline Bradley. So, Siobhan, will you help us to set the stage for today's conversation?
Well, good afternoon, good morning. Hey, Anton. Hey, family. It is so good to see so many people. And I got to do this. I just saw Camden, New Jersey. Shout out to Camden. That's my hometown. I see you all in the chat coming in from all over the country. It is so good to be on this closeout call with you. Anton, thank you for the intro. And to all the panelists and all that are on. It's about to go down, y'all. This is the 2025 pre-holiday gathering of this awesome Go Birds, I see you intersection. And let me just say this. We are in a moment, my friends, where some people will be down and out. But let me tell you something. At the intersection, we understand that the work that we do is predicated on the values that we hold in our hearts and in our minds and in our souls. And let me say this to the intersection family, over 600 strong today, almost 700 folks that are gathered around an idea that anti-racism in healthcare is a core tenet that we follow and we believe in. But all in all, we know that access to healthcare is not just a privilege, but a right and a standard we believe on this call. And so the perspective that I want to bring to you is that this work has to continue, right? We cannot sit idly by and watch what's happening around us and be spectators in a sport that requires contact. I'm going to give you context on that, right? We can't be spectators in a sport that requires contact. And the kind of contact that I'm talking about is the front and center, intentional work of healthcare systems and advocates on the front lines facing the opposition in their face. Now, I'm a Jersey girl and an Eagles fan, which lets me know that I am front and center on this context work we call advancing anti-racism in healthcare. Now, I want to say this. There's been an exceptional amount of work that has happened on the ground. The work that has been done by all of you on the ground. I saw Hawaii. I saw Pennsylvania. I saw New York. I saw Florida. I saw California. I saw Chicago. I saw folks from Indiana, the Washington State. I saw folks across this country who have been activating front and center. We know Anton's a Steelers fan. He's on the wrong side of the state. It's okay. But I will tell you this. The power that this community holds together is like no other. One of the things that I think is important to call out is that this is not just a moment. This is a movement, and it is a long game strategy plan. Okay? We are not in this for a sprint. I was a sprinter in college. I love to run fast, but running fast won't get us where we need to go in this moment. So all of us that are activating front and center in healthcare, we know that we cannot be defeated. You see, we might get knocked down, but we're never going to be knocked out. And that is the kind of premise that we want to bring on this call today. I want you to remember, lean into your values. I want you to lean into your commitment. And I want you to lean into the love that you have for those that you serve in your communities. You see, at the end of the day, the work that is happening across this country, it is connecting all the dots now. We've seen some movies before, but some plots are a little bit different. And the plot now thickens. You're watching what's happening politically. You're watching as votes have gone all over the place about healthcare. You're even watching our country pay attention to healthcare in a different way. What does that mean? That means the advocates and the leadership in our healthcare systems, you're doing your jobs. You're making sure that the communities understand what they need. But I don't want you to feel defeated. You see, there's a long season ahead of us. And I think that we're this team of health advocates plans on not only making it to the playoffs, but winning the Super Bowl. And that Super Bowl is us creating, leaning into, and ensuring that every citizen in this country, every person in this country, every human being in this country has access to a healthcare system that values their life and values the heart of who they are. And so with that, Anton and friends, I'm ready. I'm ready to go. I'm ready to pass this ball of advocacy and equity to my friends on this panel. So God bless you all. Get ready. It's going to be a fire panel, but I want you to feel the fire in your belly. I want you to know that what you are doing is changing lives. You see, when you meet at the intersection is the central point of making sure our country does what it intended to do. So my friends, I'm excited about what we're going to hear, and let's get ready to go to work. God bless you all. Anton, I'm going to turn it back over to you. Let's get the intersection panel started.
Thank you so very much, Siobhan. And I really do feel like I need to pass the collection plate after that boost of energy and dynamism, and you hit the nail on the head. So let's just get right into it. Today, we're joined by a dynamic and powerful panel of leaders who work spans policy, public health, and on-the-ground community work. Each of them brings a unique perspective to this conversation. And so I want to introduce them. And first, we have Angela Hanks, who is the Chief of Policy Programs at the Century Foundation, where she directs research and policy strategies. She has dedicated her career to advancing public policy that puts power in the hands of everyday workers, consumers, and families. Welcome her to the intersection. Next, we have Jerry Jones. He's the managing director of the Robert Wood Johnson Foundation. He has an extensive experience in working with community organizations to build bridges between health systems, public health departments, and community organizations. Let's welcome Jerry to the intersection. And our last but not least guest, and we're happy to have her here, is Becky Payne. She's the president and CEO of the Rippel Foundation, where she leads the foundation's efforts, which works to shape a future in which all people and communities can thrive. Her background is in public health, including designing and launching large-scale initiatives at the U.S. Centers for Disease Control and Prevention. So as you can see, we have an incredibly dynamic panel. We're going to have a great conversation. And I want to jump start this conversation by Angela. I'm going to start with you because I think you'd be a great place to start as we talk about the opportunity that this moment offers. And so, can you share your perspective about this moment that we find ourselves in as a country and as organizations? What does this moment offer to us all?
Thanks so much, Anton, and thanks so much for having me here today. Thank you to RWJF. I'm really thrilled for the conversation and excited to be with all of you. As people were entering the chat, I was wishing that we could have sort of a broader group conversation, but really looking forward to keeping up with it as we go along. I'll tell you what I'm excited about, but I am going to start with a few depressing things first, and then we'll get to the good stuff.
Sure.
So we are at a moment that in some ways is without precedence in healthcare. We are on the, I mean, we're beyond the precipice. We're at a point where we know that 15 million people in this country are set to lose their health care over the next decade. 4 million people potentially in a matter of the next few months may lose their health care as a result of the enhanced premium tax credits not being extended. This comes on top of numerous attacks happening at the federal level, impacting communities across the board, but especially communities of color. And so when you look at the impact of what's happening at the federal level on healthcare, combine that with the other activities that are happening across government, the picture is really concerning. I, I would say if you asked me a year ago, what's going to be the sort of major policy issue going into 2026? I will confess, I don't think I would have said healthcare,
Mm.
in part because, I didn't know there was going to be $1 trillion in cuts to Medicaid. I didn't know that the tax credits wouldn't be extended. I didn't know about sort of the numerous attacks happening at HHS and beyond, or the kind of looming state budget crises that we can expect from these cuts as well. But here we are a year later, and I do think that healthcare is at the top of every policymaker's mind, certainly in Washington, D.C., but I think across the country. And, a lot of those conversations are about how to deal with the immediate harm and challenges to communities, especially communities who are already quite marginalized in our economy and society. But I think there's real opportunity there. And that's been the thing that I have been most excited about right now. I think we all know that the system we had a year ago fundamentally was not working for enough people. At the Century Foundation, we have actually multiple teams that work on healthcare. We have a healthcare reform team. We also have a team that works on maternal and reproductive health, including and especially Black maternal health, where we run a collective that includes many members. We put out a report on the state of maternal health a year ago. The results were not good. Black maternal mortality was not going down. There is still a crisis in Black maternal health. You can extrapolate many of the crises we see there to multiple systems. Those things were not good before we got to this real crisis moment. And so I think what you're seeing from policymakers is really a complete rethink of the systems we have. If we are in this moment where there is genuine destruction across the systems in which we all work and frankly rely on for our daily lives, for the lives of our kids, our families, there is an opportunity to rebuild, and we can rebuild differently and better than what we had before. My colleague Elizabeth Oz, who runs our maternal health and reproductive justice team, had a great line in an event a couple of weeks ago where she talked about if we just go back and do the same thing, we will be destined to get the same results. And I think there's a real awareness of that among policymakers. And so at the Century Foundation, one of the things that we're thinking about going into the next year is, given the landscape on healthcare right now, what are the new opportunities? Of course, we need to protect and defend, and we need to work with our state partners in particular to make sure that they are prepared for what is coming their way. And we have to work with those federal policymakers to reimagine what healthcare can look like in this country. We know it is already too unaffordable for millions and millions of Americans. We know there are millions of Americans who would benefit from greater coverage, for greater ease. And we know we would benefit from a more anti-racist system. I'm struck by the video that was circulating on social media a couple of weeks ago of a Black woman giving birth, eventually in the parking lot, but starting out in the waiting room of a hospital. That is not the system we all want to have, and we can have a better system than that that works for everyone. And so I am very excited about that. There's a long, long road ahead, and I want to be honest about that, but I'm excited for us to engage in the conversation along with others.
Fantastic. Thank you for that. You know, that the word reimagining a system that we knew wasn't working well for everyone is really a great way to contextualize the moment that we're in. Jerry, I want to go to you next on this. RWJF is the largest philanthropy dedicated to health in this country. So, how are you approaching this environment?
Well, the way that we've been approaching it, and it started right from the jump, our CEO, Rich Besser, with a letter to the field, just to kind of serving notice that we are not only are we staying in the fight, but we're doubling down. And our approach really is that we want and expect boldness in this moment from our partners, and we don't believe that we collectively need to be limited by the imagination of those who have brought all sorts of changes are wreaking havoc in our communities. And we feel like this is the opportunity for all of us to lean into our collective imagination for the systems that we want and the communities that we want to live in. And so the way in which we're doing that is just really digging deep with our partners, really trying to get closer to them and understanding what the environment is on the ground, how we might need to show up in ways differently than we've done in the past in order to meet the moment,
Hmm.
and to begin to move toward our affirmative version of the future for health in America. That's been our position in this year.
Yeah, that's great. Great word to lean in on is boldness, and how you show up. I think that's something that we all have been wrestling with right now in this year is how we show up. And I think it's a great context for to hear how you all have doubled down on the boldness and how you show up. So my next question is for you, Becky. What responsibilities do thought leaders have to support those working on the ground in this moment? So give me some context of your perspective on that.
Yeah, thank you so much. And I almost feel like it was all said in the opening, right? So thank you for that inspiration. Thought leaders, first and foremost, we have to stay humble. We have to stay humble and curious and do our own inner work, and then show up with courage to move work forward and call others into moving work forward together, even when we don't have it all figured out. And I think that that's, some people might call that taking risk, but I really want to offer a perspective that there are real risk situations, certainly in healthcare, where you're making a decision moment to moment or day to day or week to week that could potentially save a life in the next moment. Or most decisions, when we're talking about upending systemically unjust systems, are not about whether or not there is real risk that if we take this move, we are going to kill somebody tomorrow. Not taking the move, we've got decades of data and history that tell us allowing the status quo to continue is killing people, and it is killing people differentially. So I think really, giving yourself a wake-up call about what risk really is and what that risk assessment is. And for thought leaders especially, that requires staying focused on what is the long arc and how are you offering a lifeline of hope, lifting up the bright spots, recognizing that no one person, entity, or organization does this alone. We talk about thriving together. Our paths toward thriving are undeniably entwined with each other. And so we have to stay focused on that, lifting up the bright spots and the stories of folks who are doing good work and making progress, not only so that you can, give them a platform and shine a light, but help people on the ground find each other and find each other without needing to go through any of us who sit in more privileged positions. It helps them know they're not alone. It helps them get inspiration and collectively get that courage.
Wow, that's really good that you have outlined that framework of how you help people to move forward and make sure that we all stay encouraged by it. And I wrote down the word stay humble and to stay curious was a great framing to start. So in that space, I'm curious about particularly this is for Jerry and Becky. There are a lot of people who have seen significant reductions in funding of their work either in academia or in government institutions, like significant decreases in funding. So my question is like, as philanthropies, have you changed the types of groups you engage with as grantee partners? And, what advice do you have for people who are seeking grants from foundations for very localized equity work that might have been funded differently, but is now in a different space? And Jerry, I'm going to start with you on this, seeing as that you're the biggest on the block, and then I'd love for Becky to get in on this too.
Well, I would say that there hasn't been a change necessarily in response to changes in the policy environment over the last year. What I would say over the last 2 to 3 years, as the foundation has really begun to lean in and understanding of the impacts of structural racism, in particular in our healthcare system and public health system, we have begun to move towards partners who have much closer proximity to the pain and the impacts of structural racism on the health and public health and healthcare systems. And then I would say the other is just fortifying our commitment to our partners. And we recognize that there's been a huge shift in the knowledge infrastructure, as it were, and remaining committed and truly doubling down to that regard. So if there has been any change over this last 11 months or so, I think it has been more on the side of deepening our relationships with those who are involved in this space. As you mentioned, Anton, that the challenges that our partners in academia have been facing it's just been a whirlwind, and I feel like it's taken us all a while. It took us a while to get our bearings underneath us. But as mentioned in our opening, we've seen our partners withstand those opening blows, and the fact that we are all still here, the fact that there are almost 800 of us on this call, tells me that we've taken their best shot. And now our approach is all of these amazing ideas that we've had on the shelf for maybe a year or two. We thought maybe we were a year or two away from really being able to push for a more equitable and just public health system or healthcare system. All of the partners in the field that we have been thinking like, hey, wouldn't it be nice in 2 to 3 years or in 5 years? Because of those relationships that we're fostering now, it's like, oh, it's go time. It's go time. So yeah, I think we're really ready to be, I think, not only to support our partners and as Becky mentioned, pushed by our partners in this moment to really think about how we move that alternative affirmative vision of America forward.
Yeah, very good. Becky, how about you?
Yeah, so we're an operating foundation, and so we think about what can we do to untrap as many of our assets as possible. So we devote our time, effort, and talent to understanding what works, what helps folks on the ground who are trying to move systemic shifts at a movement level. And so recognizing the privilege of being a philanthropy, how do we continue to translate that, to continue to iterate with partners on the ground, making it as resonant and supportive to the work that they're trying to do as possible. And we orient all of the conversations about health or healthcare in the broader community context in which it operates. So we support and walk alongside our partners to help them have that broader mindset shift, to recognize, again, my language is very intentional, that thriving together means that we're in this together. There is no one organization that can do it alone. We have to constantly learn and adapt, and we have to expand opportunities for building trusting relationships. That's a skill set. That is as much about how we show up to do the work as it is about a transactional intervention. So for us, that means holding the space that long arc work a decade at a minimum, but really we're talking about how are we better ancestors for future generations is the dialogue we need to call people into and help support them to hold that space. It doesn't mean walking away from the urgency of the moment, but it means being really clear-eyed about the fact that continuing to invest in perpetuating a dependency on a safety net system does not serve getting people out of a doom loop of constantly needing to have that dependency on a safety net system. If we can imagine a world where we don't need that safety net system, not because people are not cared for, but because we have truly invested in the kinds of conditions that enable people to thrive, to get out of that cycle of crisis and just barely getting back to survival, I don't think any of us want to just survive. So really recognizing that there are shifts and investments that have to happen across multiple sectors, multiple organizations. That requires building trusting relationships at the local level, especially as our federal systems aren't just crumbling, but are causing and exerting even more harm. What I love about my job, the highest form of privilege, is I get to travel around and meet with partners who are doing that work. And we are witnessing, as a community science person, an unprecedented return to the local. People love to love the place where they're from, right? And when you meet each other in the place that you're from, you start to connect outside of ideology. You have an opportunity to connect outside of ideology. You have an opportunity to connect on the things that are a shared value set. And I would encourage us to start there. So that humble curiosity, suspend your judgment, and start to connect on things that are not about the next political turn, the next budget cycle, but really talk about what is the legacy we're leaving for our children and our children's children. We know far more people agree on those core outcomes into the future than they don't. That's a value set. Jerry, you mentioned it. That's a shared value set. And then creating opportunities to interact about that before you jump to trying to solve today's problem is one way to start building trusting relationships that can start to span and bridge differences. And also getting really clear about we don't all have to go rushing into the hardest next relationship, that we have different roles and we can lean on each other to open those doors, crack open those conversations. So as a philanthropy, to answer your question more directly, our job is to recognize, again, the risk to us is actually very low. If our value set is about the outcome for the future of the world that we want, my concern as a leader has to be far less about my organization and far more about the values we are wanting to bring into the world. And I think that that is, again, where courage comes in, recognizing that individuals hold a lot more power than they give themselves permission to think that they do. Many of our rules are not rules with a big R. If it's not illegal, and there is some room to question, is this still serving us? Then you should be calling those questions. And anybody can call those questions. You may need others to go along with you to upend those structures, but we far too often fall into compliance when we are not necessarily compelled to. And so I think that's philanthropy in particular can shine a light on those moments of really questioning, does it really have to be this way, or are we just going along because it's the way it's always been?
That's
Do you
great.
mind if I jump in on that?
Yeah, please go ahead. I was going to ask you to jump in.
Yeah, because Becky, you're hitting on it. Like part of the work. So the name of my team is the Transforming Health and Healthcare Systems team at Robert Wood Johnson. And the conversation that we've been having has been, in order for us to support the work of transformation, we have to think about who might we need to become as a philanthropy in order for us to meet the moment, and not just meeting the moment and in the moment, because that's been a big conversation too. And we've made shifts in how we've supported our partners in the moment, but also thinking about the moment a generation from now, 2 generations from now, how will we set the table for those coming after us to be in that moment and meet the moment? And that requires a shift in mindset and approach. And that's something that I have seen, like, just over the last 10 or 11 months, the foundation really grappling with and starting to make changes and adjustments in order to truly be an effective philanthropy partner in the field.
Wow, very good. Uh, Angela, I want to bring you in on this. I mean, I know your work is not exclusive to health. So, how can advocates whose, primary focus might be issues like the economy or labor or voting rights, see health and healthcare as foundational to the success? Any thoughts on that?
Yeah, so since this event is called the intersection, I'll talk about a couple of intersections that show up in the work that we do here at the Century Foundation. So, healthcare is critical for all of us, right? It is both the thing that keeps us, healthy, around for our families, around for ourselves. Care is incredibly important to all of our lives, and many times, what stands between us and getting the quality care we need are things like, do I have a good job? Does it provide health care? Do I have reliable transportation? Do I have childcare for my children? Um, are they getting healthy foods? I mean, these are all questions that sort of sit outside of the healthcare system that are really critical to understanding health. And one of the ways that we've been working on health and thinking about it is really at those intersections of other points in our lives. And I'll just talk about a few. So one, as the fight over Medicaid was taking place over the spring, one of the things that we were working on across all of our teams was laying out how the cuts to Medicaid would impact things like childcare and higher education and K-12 education, and people's labor market outcomes, because those are all pieces of the puzzle, right? Like, we are not just people who consume healthcare. We are multidimensional. We are workers. We are consumers. We are parents. We are people outside of those systems. And when those other systems are not working for us, health is also going to be elusive as well. And so a lot of our teams have been thinking about kind of where those intersections between health and the other issues that we work on here come into play. And then the other thing I would say is another way that we've been thinking about it is also in terms of Americans' financial lives. We've done a bunch of research in the last couple of months, asking people questions, putting out analysis, looking at how people are faring in the economy right now. I think it will surprise no one on this call to hear that people are not faring very well.
Mhm.
They're concerned about things like rising costs, jobs not paying enough, losing access to things like healthcare, and they're trying desperately to figure out how to make ends meet. One of the, I think, more worrisome things that we have been seeing is a lot of times uh, those concerns and the ways that people are able to address them just to have their basic needs met come through in a form of debt. And so, in the healthcare space, of course, we think about medical debt. I mean, there's like over $200 billion of outstanding medical debt. Um,
Mhm.
the majority of adults in America have some type of medical debt. But it's not just medical debt, right? If you have an unexpected medical expense, I worked at the Consumer Financial Protection Bureau before this. That unexpected medical expense can show up on your credit report, that can be a barrier to you getting a job if they're checking your credit, right? Um, it can also show up in other forms. Maybe it's delaying big purchases like buying a house or sending your kid to school. Or oftentimes it shows up as other forms of debt, like credit card debt. And so we're really looking at all of the ways that healthcare is both important for the care of our communities and for the ways that we care for each other and the health of our country and our communities overall, but also as an economic issue. What does it mean to have an economy where people are forced to put surgeries on a credit card when their hospital provider is also a credit card company, right? Like, those are kind of other concerns about the economy that really, I think, make us quite worried. And so we're trying to think about it in all of the different ways that the system can be uh, is currently really having a negative impact on millions of people, but could be better, and we could get out of the system of people finding themselves um, with just like not enough money to pay the bills and no room for error, no room for getting sick.
Yeah.
Can I
Becky, I
add
saw you
on?
nod your head. Please go ahead and get in on that.
Yeah, so everything Angela said, and I kind of mentioned that we put health and healthcare in a broader context. And again, we've studied a lot of this, and I just want to share for folks because it's a powerful organizing tool. So if folks in the group find it helpful, they should go to our website and find it and use it. We have a lot of resources, but a lot of folks have heard about social determinants of health, and we've been at it for a couple of decades, and we've done a really great job of shining a spotlight on the problem and the context and giving some language. We have, if we're all honest, and I've been a part of it, I was 20 years at CDC and in state public health before that, we have failed to make progress commensurate with the amount of resources, time, and talent put into it. So with some support from Robert Wood Johnson, actually, a couple hundred contributors several years ago said, what is needed? How could we do this better? And out of that was born the vital conditions framework. It's 7 vital conditions. Angela rattled off many of them. But for this group in particular, I want to highlight, I'm going to do this because we show it as a circle, six conditions around one, which is the heart space, and that is belonging and civic muscle. And they have to go together. They go together very intentionally. And they start to create a powerful abundance loop. And in times of trying to deal with an equity anchor, and also recognize that resources are constrained, and yet there is tremendous talent sitting on the sidelines in our communities. If you have to start somewhere, and we've got modeling, we have a lot of modeling data and ways in which we demonstrate this. We would encourage you to hold the complexity of all 7 together, because that is the reality of how people navigate the world. However, the best first investment is in belonging and civic muscle, and that is because it is the way we all build skill and capacity to listen, to be together, to invite in meaningful ways the voices of those who have not historically felt valued, heard, or their ideas and solutions taken up. And the civic muscle then has to be paired with outlets to practice that working together. And as you do that, then you build trust, and you start to suddenly be able to encourage others to come off the sidelines because they're watching what's happening and they're seeing, oh, this is different. They're listening, they're taking our solutions into account. As you build that vital condition, it is through that capacity that is gained from community members trusting that they are valued, and leaders developing a different way of meaningfully engaging their community members and being responsive. Then you can design the rest of the systems: reliable transportation, thriving natural world, humane housing, meaningful work and wealth, the things that Angela rattled off. Then you can start to design them, drawing on the assets that you have built through belonging and civic muscle in ways that will be more responsive to addressing the wide disparities that we've had. So I wanted to give that a little more context and share that there are a lot of resources. We have a number of other communities. And the other thing I'll say is we are seeing investment when we've seen community foundations. So all of you have community foundations in your backyard. Community foundations in particular are starting to find that framework to be a powerful way to unlock local philanthropy, to organize giving at the local level that stays in their community in service of those vital conditions. And we've seen a number of foundations launch special funds, especially around belonging and civic muscle. So that's just something to go talk to your local community foundation about if you have those connections.
That's fantastic. Thank you for sharing that framework. It was very clear and crisp. I think everybody was able to see the full picture. Jerry, I want to bring you back in here, and I got a particular question for you. You know, your experience is very vast, and you have lots of experience across health systems and community-based organizations. What do you think cross-sector partnerships can do to navigate these current challenging times, whether it's in policy or funding the community needs? What do you think about cross-sector partnerships and how they might be able to help?
I think the cross-sector partnership is absolutely essential. Because I'm thinking from the standpoint, as you were talking about, Becky, that sense of belonging and civic muscle. I feel like that bringing together various levels of interest, um, and when that can begin to intersect with the various resources that we're pulling together, we're talking about building power. So to me, when I'm thinking about cross-sector partnerships, I'm really thinking about what is the exponential power that can be built and mobilized to truly execute this vision that we have for America. And to me, it does foster that belonging that Becky is talking about. Because what happens when you start to pull folks from the neighborhood and from the health system and the business community and the faith community, you start realizing like, even though we've come from different paths, we have some shared interests, and now we have all of our resources, not just our money, but our experience, our perspective on that experience. There's so much that we have that I'm not sure that we've collectively realized the amount of power that it'll take. I have been, and my team, we've started to follow the impact of artificial intelligence on communities, and starting to recognize like all of the things that are necessary to power this new AI generation. And in my mind, I'm thinking about, but look at all the power that we have available to us right now so if there's a vision of the future that is artificially powered, imagine the power that we could generate to move towards an equitable and just society. There's so much opportunity. So when I think of cross-sector partnership, Anton, I am thinking about all of the untapped potential for power. And power in my worldview is not a negative, it's not a pejorative, it is a requirement in order for us to achieve very achievable change. And so I think we should practice cross-sector partnership as radically and as frequently as possible, especially in the moment that we're in.
That's good. As radically and as frequently as possible. Really, really good words. Angela, I want to bring you in. I got a question for you. And the question is like, how can organizations remain vigilant, like in during these times that all these things going on, particularly as it relates to protecting equity? Any ideas or thoughts of how organizations can stay vigilant in the effort to protect equity in the year ahead?
I'll maybe go back to something that Becky said, which is we don't have to comply in advance. I saw someone put in a chat about how we protect and support immigrant and refugee communities during this time. And I think that's a great example, right? During this healthcare debate, there was a lot of misinformation about immigrant communities circulating on the news, in the newspaper. That was really damaging, right? Really damaging for the programs, but also for immigrant communities who need health care, right? It certainly has a chilling effect when people are effectively told that they might not be welcome if they go to the hospital when they're sick or they have cancer or their child has broken their leg. And so I worry quite a bit about what happens when the rhetoric sort of gets ahead of the policy and what that means for people. But I think as people who are providing incredible care to millions of people across the country, the most important thing you can do is use the expertise and the knowledge and frankly the law that's on your side to continue to serve those communities. I think that feels really important. And then the other thing I would say is um, this is a really pivotal moment, and we will be beyond this moment at some point. And so continuing to think about that reimagining that we talked about, we have to stem the harm. There is no way around that. But we want to have systems on the other side of this that are genuinely, meaningfully inclusive, that address deep disparities we see by race and ethnicity. in our healthcare system that make it more affordable and accessible and provide better care for all. And we're learning lessons all along the way, right? So I think,
Mhm.
there is this risk that we will see some backsliding because of the environment that we're in. But I think as much as you're able to push ahead and really think about those opportunities for the future, all the better.
Yeah, very good. I got two more questions that I'm going to have for all of you. But before we do that, we're going to take a poll. We're going to share a quick poll. This is going to help us to think about this community in the year ahead. And so we're going to put the poll on the screen, and we're going to give everybody a couple of minutes, not even a couple of minutes, a couple of seconds, if you will, to answer this poll about the intersection. Like what's valuable to you. The hosts, you can't vote. Panelists, you can't vote. But for the 700 plus people, almost 800 people that we have on, we want to hear from you a quick second around your feedback to this. That'll help us to plan. And so I'm going to prepare my last two questions for all of you. And again, this has been insightful and I think impactful because what we're doing is we're trying to build community and keep community supported. And so my next to the last question, not my last question, but my next to the last question for all of you is, as funders, or philanthropy, you're in philanthropy. We know how important it is for your grantees to find community and to get community to learn from each other and grow from each other. Any perspective would be helpful for me to hear, like, how are you all finding community in this moment? I think Angela, you started about, your colleagues are working together to figure out how you reimagine a system that isn't flawed, it isn't broken. I know you're probably not doing that in a vacuum by yourselves, but I would love to hear some insight, some context around how you find community in this moment and what does it mean to you in this year to have support. And I'll start with you, Angela, and I want to hear from you, Jerry, and then you, Becky, as well.
Yes, I mean, I'll borrow for some of my colleagues' experiences, but it is not hyperbole to say that we could not do the work that we're doing without the support and partnership of many, many other people and organizations across the country. So much of the work at the Century Foundation over the last year has been about telling the story, figuring out new and creative ways to explain to the public what is happening in healthcare right now, how it impacts them, and how to be engaged. And those things are nice if they sit on our website. We have a great website. Would encourage people to visit it, but ultimately aren't as impactful if they're not getting out into the communities that they're designed to reach. And so we both partner with other organizations on things like actually doing the analysis and doing the data work, but also to try to reach communities that we are not in. So that has been really, I think, an incredible part of our work. And then we also have these pieces of our work where we really intentionally and regularly bring folks who come from different places in the movement into the fold to talk together about how to proceed. So I mentioned at the beginning of the call, we have the Black Maternal Health Federal Policy Collective that one of our teams engages. That is a group of people and experts who come from sort of different areas of this work. Everyone isn't like a DC think tank person. There are people around the table who are practitioners, who are advocates, who are organizers, and really thinking about across all of our work. I will, again, shout out our teams. I think they've done a really nice job of building those relationships and partnerships. So our work is both deeply informed by communities, but that we're also able to disseminate out to communities as we're doing research and analysis that a think tank is well positioned to do.
Very good. Thank you. Jerry, how about you? What are you doing to build community, keep community?
You know, the things that my team has been doing around um, building up cohorts of partners who are not just serving their community, but actually a part of their communities. I think about in particular our partners in the reproductive justice space, and seeing how that group of folks rallied around one of my team members who had to step away for a few months, um, and to see how that team supported each other and provided leadership for me and my team while we were down, like, and just to see the love um, that germinated from those few months of them really stepping up and supporting each other during that time. It was a testament to me that the work of my team is really truly rooted in getting into community, and so now I'm seeing more of that across our entire portfolio, where we're just continuing um, to make ourselves available,
Mm,
to be in relationship, to be challenged, um, to be corrected. So yeah, I think the way we're looking to build community is to, I think Becky, you spoke to that humility. Like, how do we come to a place where we recognize the extent of our understanding and recognizing that we have to get closer, and in order to get closer, there are things that we are letting go, and a big part of the letting go is the letting our guard down
mhm,
and being willing to be led
mm.
by our community, and and in doing that, that's how we're finding.
Man, that's so good. Being willing to be led. That's a great perspective on leadership as a leader. Is that sometimes you got to listen to the people that you lead and being willing to follow in that space. Great thoughts there, Becky. How about you? What are you doing to build community and keep community
Yeah.
during these times?
Well, again, I love that as well, Jerry, willing to be led. And I think it is the humility piece, right? And it's also permission, like we're not alone. We're just not. You know, there are a lot of ways in which we are encouraged to retreat and to feel isolated. So for me, that's about being intentional. I am actually an introvert who lives in an outsized way. And so that's also like holding some boundaries and guarding my energy, not to shy away from things that challenge me. And I really think that's an important difference. Really leaning into things that challenge me, but doing it in ways that are energy preserving, that I recognize I have far more control about that than I might think I do in a moment. But my team, we're a virtual team, we're remote across the
Mhm.
country. So really intentionally trying to connect with them, support them, hear how they're doing and what they're working on. I get to go and travel and visit with partners across the country. I have a crazy family life in which we are a multi-city family, which gives me options, but it also gives me perspective. I
Mm.
consider Atlanta my home base, but we have roots in Cincinnati, Boston, and very far North California. And that is a very diverse and vast ground to cover. And it's incredibly humbling and um, energizing. And I learned so much about recognizing that there are so many different ways and perspectives to come at this work. And when you're anchored in one place, you get anchored in those traditions and those perspectives and how far a conversation can go and the language you use. When you broaden your horizons, you also learn that there are many ways in which this path can unfold, and intentionally seeking out those teachers and recognizing how many ways there are, I think is also gives you permission, back to Jerry's point of you're just not alone, and you don't have to, nobody expects any one of us to have the answer. What I expect of society is a social contract where we are coming together to collectively build upon each other and chart a path forward. So that to me is very life-giving.
Mhm.
And I also just count it a blessing for me personally to have such alignment with my core values and what I believe in this world with the work that I get to do. And that's what I remind the staff all the time, even when it's so hard and it's dark, and it is, and I get tired too. It is a tremendous privilege to get up every day and devote our working hours to this work.
Mhm.
And not everybody gets to do that.
Yeah. Awesome. Thank you for sharing. All right, this brings me to my last question, and because I like to end us being future focused. We're at the end of a year. We're going to a new year. So I'm going to ask you each to give me a one and one. And when I call one and one, and that is because we're future focused on the next year, what's one goal you have for this work next year? So give me some sense of one goal for the work you have once a year. And then I want to be future focused on leadership. And that is, we have a lot of emerging leaders who are in this session who join us. What's one piece of advice would you give to an emerging leader who's doing DEI or anti-racism or health equity work? Just one piece of advice for those future emerging leaders that we have. So one goal that you have for next year for the work, and then one piece of advice. And I'm going to start with you, Angela.
I would say my goal for the year is to make sure that we don't lose the momentum that we have on healthcare right now. Like I said at the beginning, it's a top issue right now, and a lot of things are happening in the world. And I think if we lose this moment, what we'll be left with is a ton of people having lost coverage and nothing to show for what comes next. So I really think continuing to drive a conversation on what we need in our systems is really important. Uh, my advice would be, I think for any of us who have spent our careers working on racial equity, on racial justice, but especially right now, it can often be a very lonely place, right? Uh, Even now, there are times where I am in conversations and I'm like, am I really going to have to be the person who brings this up? No one looking around like no one else, and that becomes even harder when there is, on some level a real fear, but on some level an excuse to step away from those commitments. And so I think being prepared for that loneliness and to be able to push through and find community where you can in order to push through is really important. And so I hope everyone's able to do that. And I also hope you all are getting a little bit of rest this holiday season too, because there's a lot of work to do ahead.
Thank you so very much. Jerry, how about you? One goal, one piece of advice.
Stretch goal. I want us to have a playbook. They've shown us their playbook. I want us to have a playbook. I know it's only a year, but it's a stretch goal. I believe we can get there. One piece of advice is, when you have hard times like my Kansas City Chiefs and people want to write you off and celebrate, just keep grinding, keep working, and know that you're right, and know that your work is not in vain, and reach out. When in doubt, reach out, connect with your peers, and you can lift each other up.
Awesome. Thank you. Becky, how about you?
I'm going to break your rule. So we're laser focused on a goal for the decade. And I'm going to invite everybody on here to join us. We are going to be some point in the next year making a formal call for everybody to join us in, no joke, trying to increase the number of Americans who report that they're thriving by 20 points in the next decade. That's a whole other podcast, so my goal is energizing and getting as many people on that train as possible to show that we are so much more powerful than any countervailing forces believe that they are. So that's our goal. And the advice I have is to take the long view. And remember, you can't, nor do you need to crash every wave, and to stay focused on what's truly important. And I know that we're being robbed of words, but stay focused on the work and stay focused on the people who have the most to gain, those who are struggling and suffering the most. They don't care about our egos. They don't care about who gets credit. What they care is that we actually are making an impact that will be enduring and change their lives. And so you're going to have to navigate and dance, but if the end goal is the impact, let some of it go and preserve your energy.
Great. Well, Angela, Jerry, Becky, I want to thank you for being here and sharing insights. For all of you who've joined us, there are no breakouts today. We're ending right now. I want you all to stay connected with The Intersection. You want to sign up for updates, go to meetattheintersection.org. Make sure you follow our LinkedIn page and subscribe to our podcast on Apple, Spotify, Amazon. We're excited about the work we've done this year, but we're more excited about seeing you at the intersection in 2026. I want to thank you again for being here. Everybody have a safe and happy end of your calendar year, your holiday season, and look forward to seeing you in 2026. Have an amazing day.